At the beginning of the coronavirus pandemic back in March, healthcare workers were being applauded for their tireless efforts on the front line. But now, with COVID cases surpassing 57 million globally, these selfless and dedicated heroes are fatigued, frustrated, and feeling underpaid, underappreciated, and unprotected. Welcome to Our Voices. I am Auriane Itangishaka. On today's episode, we take a closer look at those who are on the battlefield against the coronavirus, the frontline healthcare workers. We'll hear about some of the challenges they face to keep the oath that they took to take care of the sick, and the challenges that the governments and the healthcare systems are facing to protect them emotionally, physically, and financially in the battle against COVID-19. One country trying to do its best is Uganda, where the healthcare workers say they are seeing some success in fighting the fast-spreading coronavirus. Since April, Uganda has confirmed over 18,000 COVID cases with nearly 8,700 recoveries and 172 deaths. But healthcare workers battling corona face stigmas outside the hospital. Hilma Athumani reports from Kampala.
The high-risk COVID-19 ward at Uganda's Mulago National Referral Hospital was filled to capacity in the past month. But the hospital says recoveries have kept pace with and even surpassed the rate of confirmed coronavirus infections.
We said, okay, let's see how this virus will kill people if we maintain them on their normal drugs. If they are hypertensive, we treat hypertension, we treat diabetes, we treat ulcers, we treat all forms of diseases. And I think that was part of our success.
Dr. Fred Nakwagala says past lessons from Ebola and cholera outbreaks helped prepare them. But he admits COVID-19 poses new challenges, including for healthcare workers.
You remain with that sense of fear, anxiety, and also for you may be strong, but your family where you stay, your community where you live and travel. And there's also the issue of stigma. If you go into a market now and the people in the market, the supermarket know you, they kind of don't want to serve you. They kind of feel like they don't want to associate with you.
Ugandan Health Minister Dr. Ruth Aceng says the only new confirmed cases of coronavirus are coming in from other countries.
Nearly 23 truck drivers who came either from Kenya or from Tanzania. Within the country, we have not been getting positive cases. And as we draw close to the end of the lockdown, we need to have vital information that will form part of the decisions for lifting the lockdown.
Uganda's lockdown restrictions on movement and gatherings are set to expire or be extended on May 5th. To help make that decision, the Ugandan Health Ministry will conduct a nationwide rapid survey on community transmission, including 20,000 tests for COVID-19 to see if more infections are being missed. Halima Athmani for VOA News, Kampala.
Thanks, Hilma Athumani, for that report. Healthcare workers treating COVID-19 patients says that their work forces them into depression or therapy. Last week, a study released by Yale's School of Public Health found that COVID-19 pandemic has taken a psychological toll on healthcare workers, with almost 1/4 showing probable post-traumatic stress disorder and more than 40% reporting probable alcohol use disorder. In Kenya, medics have been attending counseling sessions to help overcome the stress and psychological trauma that comes with fighting the virus. Mohammed Yusuf reports from Nairobi.
John Moishohio is one of thousands of Kenyan medical workers treating COVID-19 patients. With the stress of the pandemic already on him, in late July he also tested positive for the virus.
As a human being also, I'm also thinking aloud that I'm positive for COVID. What will happen next? What if death comes and It's not easy. It is really a traumatizing state, and especially being out there. You cannot tell people because you don't know how people will take it.
Moisho here is one or more than 700 Kenyan medical workers to test positive for COVID-19. A trained psychologist, he was so upset by the diagnosis, he had to seek counseling himself. He wasn't alone. On an August weekend, 50 medical workers from Tigoni Hospital Treatment Center attended mental wellness counseling sessions.
We have been going through a lot. The schedules have changed. We have been very busy, and so having a day off where you're having fun, forgetting there's COVID, it was very, 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 very rejuvenating.
I feel a bit lighter. I feel like I'm very relieved. I feel like I have now gained the strength to continue with my daily duties.
Like their colleagues worldwide, Kenyan medical workers have been working long hours to attend to patients infected with the virus.
A lot of those small trauma end up piling up, and it can be really psychologically distressing. So we decided that we will come here and have a day of expressive therapy, debriefing, art therapy, bonding, and having fun and games. You know, it was a day to make the health workers feel like they are loved and appreciated.
With the pandemic ongoing, it is a day that these medical workers certainly needed. Mohammed Yusuf for VOA News, Nairobi.
Now to talk about some of these challenges and more, my colleague Hedy Adams Fitzpatrick spoke to Lorna Johnson, a Los Angeles-based nurse, midwife, healthcare executive, and philanthropist. Ms. Johnson is petitioning for all first responders, nurses, doctors, and healthcare workers to be equipped with all the tools, resources, and support necessary for them to do their job.
Lorna, why did you start this petition?
Because when you're in the military during war, they have these special provisions that they do have, and that would make them have more pay in terms of hazard pay, more paid leave, therapy and grief counseling, because it's very hard working in this environment, not having the proper grief counseling. You're afraid of taking this virus home to your family, and mandatory testing to make sure that they don't take this home to their family. So this is the least I could do. They're taking care of us. The least I can do is to petition and make sure that they're being taken care of, because they are our heroes.
Every day we hear stories about what frontline health workers go through. Can you give us a little bit of insight into that? What are the effects on their mental, physical, and emotional well-being?
This pandemic is one that we've never seen before. Protocol, everything went out the window with COVID. And so their nurses were at risk. They were reusing masks. They didn't have the proper shield for to cover their faces. They're afraid to go home because they're afraid to take the virus home to their families. Most of us work in women's health. We very seldom see people die. But here we are, they have to transfer some of these same people that are working in women's health over into the other units. It's very traumatic. It's been very, very traumatic. I think COVID is going to be here for a while. And the way we do things, the way we look at things, everything is going to be different, because right now, I think we're getting ready for another surge. And of course, it's more politicized here in the United States than most other countries. It is a political issue. It's a red state and a blue state. So because of that, there is no cohesive way of managing this virus. And that's the only way we're going to combat it or beat it, is by making sure that we have leadership that's going to do a comprehensive care in terms of management. Right now, you have different states have different rules. And so it's very, very challenging. We don't have enough testing. That I don't think we'll ever have enough anytime soon. But I know it's better in terms of where we're getting the supplies that they need. It's much better than when we just started.
I'm sure by now health workers around the world feel like they're part of some sort of global family, given that their experiences are universal. What is your message to frontline workers in countries across Africa?
I would say keep going, keep at it. keep doing what you're taught to do, because it's hard for all of us anywhere. They really don't need my voice or my message. And I can speak a little bit on Malawi, which is one of the poorest countries on the continent, and they have about a total of about 7,000 cases and less than 200 deaths. They're used to, pandemics, or, they're used to having these crises, whether it's Ebola or malaria. And they're not used to having all the supplies and equipment and all the necessary things that they need. They've always been used to compromise or try to be creative. For example, if I talk about one of the agencies or one of the organizations that I'm affiliated with, it's called IDA, I Demand Access. And what they're doing in their little village, they're going door to door, basically, or knocking on doors and giving people food and masks and educating them on it, because otherwise they don't have TV and radio to hear what's going on. They're taking it very seriously in their little village, and they have horns that they drive around and loudspeaker speak to the folks. And we have so much here, and we're not able to contain it. So that's the difference, I think.
It's time to take a quick break, but when we return, we'll introduce you to medical professionals who are demanding hazard pay and personal protective equipment, and those who are finding better employment opportunities by leaving the countries they work in. Stay with us.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Welcome back. You're with Our Voices. The pandemic is weighing heavily on the medical workforce around the continent, with doctors saying enough is enough. We go to Zimbabwe, where doctors and nurses are challenging a Ministry of Health rule that they say impedes their ability to leave the country. The ministry says healthcare workers must have an official certificate of good standing to get to work abroad. Doctors say it's an attempt to stop a mass exodus after poor treatment during COVID-19 pandemic. Columbus Muhunga reports from Harare.
After more than 10 years of working in government hospitals, this 36-year-old doctor who did not want to be named says countless protests have not resulted in a decent salary or better working conditions. He applied to work in England, but for nearly 3 months now, he says he can't go because he's still waiting for a certificate of good standing from the government that foreign employers require.
I want to leave this country to work where I can treat people properly with all equipment and medicines. Also, I want a salary that can look after my children and my parents who paid for my education fees, and to fulfill my dreams, being a doctor.
The Senior Hospital Doctors Association of Zimbabwe says its members are frustrated by delays they attribute to the government trying to curtail a brain drain among health workers. Its leader says the government is misusing the certificate of good standing.
It will now cease to be about that. The moment we allow it to be made use of by the government in this manner, it can be abused as a way of handling labor issues rather than being a professional issue.
Dr. Musara added in some cases doctors just want to go abroad for further education and return to Zimbabwe. Health personnel in Zimbabwe have long protested about poor working conditions, including inadequate personal protective equipment, PPEs, during the COVID-19 pandemic. But the cash-strapped nation has been unable to improve salaries or provide needed supplies. Zimbabwe's Vice President Constantino Chiwenga, who is the country's new health minister, told doctors this week that he would address all their problems.
Your work will not go unnoticed. Do your best, and I will do my part. And together, we can avoid the ongoing unnecessary loss of life.
He did not talk about preventing healthcare workers from leaving Zimbabwe. Health officials said they would not comment on the issue after Chiwenga's promise of solving the doctors' problems. Columbus Mavunga for VOA News, Harare.
Thanks, Columbus, for that report. Other healthcare workers have taken to the streets or have chosen not to come to work at all, particularly in South Africa, Kenya, and Nigeria. Nigerian doctors went on a nationwide strike in September over unpaid COVID-19 hazard allowance and inadequate protective equipment. Other healthcare workers groups and associations are threatening to join the strike as more than 1,500 Nigerian healthcare workers have become infected with COVID-19. Timothy Obwezu has the report from Abuja.
It's been 4 months since frontline nurse Emma Salome Julius left his wife and 3-month-old baby to join a team of health workers responding to the coronavirus at an isolation center in Abuja. Due to fear and stigma attached to the pandemic, Julius did not reveal to family the nature of the job he had taken. Weeks later, he contracted the virus and feared for his life.
I had fever, I had cough, I had difficulty in breathing, I had diarrhea, I had lost appetite. I could not eat for close to 2 weeks. By the time I was discharged and I checked my weight, I had shedded over close to 15 kilograms.
Julius was paid 1 month's wages for his service and debated whether to keep the job. Then 2 weeks ago, he and many of his colleagues were dismissed after an uprising over unpaid allowances at his isolation center. Since then, Julius has been in quarantine without pay in this hotel room as he waits until it's safe to reunite with his family.
We feel we were used, infected, and abandoned.
For weeks, healthcare employees have been demanding hazard pay and adequate protective equipment for workers on the COVID-19 front lines. An estimated 1,000 Nigerian health workers have contracted the virus. Officials addressed medics who protested along the streets of Abuja late August.
We are fighting this war with you, and we will not deny you of all your allowances and your benefits. Among the 36 states and Abuja, we will be paying you regularly based on our own agreed allowances.
But the National Association of Resident Doctors, NARD, says the government has been insensitive to health workers' issues.
I think that the government is so serious and resident doctors have been patient enough and we're giving them enough time to come up with solutions.
Strikes by medics are common in the West African nation where healthcare system has been underfunded for years. But experts worry that the strike at this time could affect Nigeria's ability to respond effectively to the coronavirus pandemic. Timothy Obiezu for VOA News, Abuja.
In Nairobi, doctors went on strike in August to protest delays of salaries and a lack of protective equipment when treating patients who may have COVID-19. That strike will settle within a month. This week, Kenyan doctors are threatening to go on strike again in December if the government fails to address their concerns. The threat to paralyze medical care in Kenya comes after at least 10 doctors died from the virus this month.
We reached out to Kenyan Medical Practitioners, Pharmacists and Dentists Union, KMPDU Secretary General, to ask him about their approach to workplace safety.
So first and foremost is to say that the strike option that we normally undertake is usually as a last resort. It's never in our interest to go on strike immediately because it has its own implications and it has its impact, especially on the people who depend on us to provide healthcare services. The issues around the strikes revolve mainly around the lack of personal protective equipment, poor terms and conditions of work in the context of COVID-19. So as per our law, that is the Occupational Safety Health Act 2007 in the country, that defines the responsibilities of the employer and the employee in hazardous work environments like COVID-19 has presented upon us. The duty to provide personal protective equipment is upon the employers, and in this we have government facilities, we have private facilities, but the concern mainly has been in the government facilities. That's where the biggest failure has been in regards to provision of personal protective equipment. Yes, we have, and the good thing is one of the initiatives of the government, the Kenya COVID-19 Emergency Fund, has allocated enough funds to ensure that they provide personal protective equipment in the COVID-19 disease, which are 56 in number. But beyond that, then the county governments, the Ministry of Health still has to provide personal protective equipment in the other facilities. Remember, we have high spread community transmission, which means every patient coming to the facilities is a risk factor. Presents a risk to the healthcare workers. So that is where the gap has been mainly, and that is where you're seeing healthcare workers still advocating for provision of personal protective equipment. And lastly, promotions of the healthcare workers at their workplaces. These are supposed to be basic things, and for promotions, these are things that are supposed to happen annually, and where we are seeing that healthcare workers are stagnating and doctors are stagnating for years, up to 9 years, 10 years, not being promoted and earning the same salary despite the fact that they are subject to salary reviews, which are already in documents that we have signed. They're not new salaries. So it's just that every year there has to be an increment and all that. So basically is to say that these industrial actions have been undertaken after failure of conciliation processes, and so the strike becomes the last option. That is why you've seen the strikes that we've seen, and we currently are seeing in various counties across the country.
That was Dr. Machonda Chimbanzi, Secretary General of the Kenyan Medical Practitioners, Pharmacists and Dentists Union. Now we're going to take a short break, but first, is it wrong for the governments to prevent doctors to find better jobs outside the country? Or should the medical professionals strike for better pay during a pandemic? You can tell us by connecting with us on social media. Our handle is at VOA Our Voices. You can also drop us a message on our WhatsApp. Our number is right there on your screen. When we come back, we'll hear from African medical professionals sharing their personal stories of being on the front line during the pandemic in our Your Voices segment. We'll be right back. Welcome back. You're with Our Voices. Today we hear from frontline healthcare workers who are the backbone of the daily fight of the COVID-19 pandemic. From a medical laboratory scientist in Nigeria to a pharmacist in South Africa to a nun and a medical doctor from the Congo. Here are today's voices.
I am originally from the Democratic Republic of the Congo in central Kasai and from the Louisa Diocese. I'm a nun and a doctor. I still work here in Italy, in Lombardy, the country's most seriously affected region. I was doing my work here like any other doctor. In the month of February, we had an epidemic explosion, which demanded our complete availability as doctors. And I decided to sign up, too, contributing to help those who are sick with COVID-19. In the hospitals, there has been a huge increase in patients who have found themselves in intensive therapy. For example, we found ourselves with only 12 beds and 400 patients, so I said to myself, instead of going to the hospital, where there are already many doctors, I'll visit the people who are sick at home. I have visited many homes so far. We have found ourselves with fewer health workers, fewer doctors, and so many patients, way too many. We couldn't manage. And we were seeing doctors who were supposed to help patients dying as well. One group of doctors couldn't leave the hospitals because they could contaminate other people. So, psychologically speaking, this crisis had a really negative impact.
As for fear, well, personally, I like to dare where others dread. Of course, that is the pivot of my job as a med lab scientist, adhering to standard operating procedure, though I fear risking my family. For me, sacrifice is my watchword, and I derive satisfaction in rendering service. I'm glad to be part of a great team working to change the narratives for Nigeria, Africa, and indeed the whole world as duty calls. Definitely someone must do the job. I urge colleagues to be up and doing. Let's join hands together and fight this deadly monster called COVID-19 so that the world will be a better place for us to live.
Trying as far as possible to keep everybody safe. We're working in different teams, rotating on a weekly basis with only 2 pharmacies running, but we still seem to get an explosion of patients on a daily basis. Trying to keep all the staff calm, as every sneeze that comes into the door and every cough is a potential risk for all of us. We've put up perspex along with the danger tape between us and the patients. We've put stickers on the floor so that people can see where they must stand. But everybody is still scared. Every time somebody coughs in the pharmacy, everybody looks around and everybody is oblivious of what's going on outside. The many people that are standing queuing and queuing and queuing, waiting to come into the pharmacy, it's not diminishing. People are there all day long, from morning to night. Hopefully this will end and hopefully people will start realizing the dangers and keep to their quarantines, keep out of the public and keep at home to stay and keep everybody else safe.
We'll have to end it right there, and thank you all for your time with us. Don't forget to go to voanews.com for the latest news from around the world. On behalf of VOA and my colleagues here at Our Voices, have a wonderful day.